When should you consult a doctor about your headaches? When evaluating a patient for headache, in general, we look for certain warning signs or red flags in the history and on the physical examination. Typical red flags that would make me as a neurologist worry would include things such as the headache being associated with fever or stiffness of the neck or body pains or joint aches, which would make me think that the headache is a manifestation of some other illness like an infection such as meningitis, a worrisome condition. Other indications would be if the headache were associated with some neurologic deficits, numbness on one side of the body, weakness on one side of the body, difficulty with speech or understanding what is being said to the patient, or difficulty in vision or eyesight. Again, that would make me worry of a neurologic complication. The headache might be the manifestation of a stroke, or worse still, a brain tumor. Also, how did the headaches occur? Headaches that have their onset with coughing, straining, exercise like weightlifting or sexual activity can be a worrisome indication. It might mean that, in fact, the headache is a manifestation of a bleed into the brain, a hemorrhagic stroke, or an aneurysm that is ruptured. Alternatively, those same things causing headache could be the result of a brain tumor in the back of the head that interferes with the pathways of the cerebral spinal fluid. Also, at what age did the headache begin? Headaches that start after age 50 for the first time are worrisome. As we get older, we're more likely to have other medical conditions, brain tumors, inflammations of the arteries, a condition known as giant cell arteritis, which causes headaches only after the age of 50, with associated jaw pain, tenderness of the scalp, and if untreated, blindness. Brain tumors are also more likely, or metastasis from other tumors to the brain are more likely after the age of 50. So the age of onset is a red flag for us. Also, lastly, a change in the pattern of headaches. So even if you've had a long-standing history of headaches, but the headaches you're coming to me with now are different than your usual headaches. They have a different quality to the pain, they have a different location, that would make me want to investigate further. And then the last reason, which is not necessarily a dangerous reason, but a red flag being the headaches are interfering with your life. You're having trouble going to work, going to school, taking care of your family. They're so frequent or so disabling that you just can't function normally. You need to go to your physician to get appropriate treatment for these headaches.